Have you ever had a traumatic brain injury? Do you even know what exactly a traumatic brain injury is? According to the Center for Disease Control and Prevention, a traumatic brain injury is a disruption in a normal function of the brain that can be caused by a bump, blow, or jolt to the head, or penetrating head injury. Effects that are possible to result after are memory loss, mood swings, impaired language, coma, loss of consciousness, loss of sensation in the body's extremities such as your fingers or toes, increased risk of stroke and or seizure, impaired cognitive functions, loss of balance, partial paralysis, and Alzheimer's and Parkinson's disease. Traumatic brain injuries are very common things to happen to people, especially during any other activities, including involving collisions directly to the head or around the head area. TBIs can happen to anyone, so it's important to know what causes one and how serious they are. Although I have not personally had a traumatic brain injury, I do know what it's like to live with someone who has struggled with one. So I by all means do not know a lot about TBIs. I only know what it's like to live with one and how much different it is. I'm here to inform you about what I recently learned about traumatic brain injuries. So let's jump in and learn about traumatic brain injuries. A traumatic brain injury is a disruption in the normal function of the brain that can be caused by a bump, blow, or a jolt to the head or penetrating head injury. Everyone is in risk of a TBI. Traumatic brain injuries can happen to anyone at any time at any age. Every year, about 1.4 million people in the United States sustain a traumatic brain injury, while most of these people happen to be children, adolescents, young adults, and people over the age of 75. The highest risk group is males aged 14 to 24. Most people are unaware of the overwhelming nature of a TBI. TBI is classified into two categories, mild and severe. A brain injury can be classified as mild if the person who is injured lost consciousness or is aware of or was in state of confusion or disorientation for less than 30 minutes. Some other effects that determine the difference between a mild and severe injury is a headache, difficulty thinking, memory problems, attention, mood swings, and frustration. A severe brain injury is associated with loss of consciousness for more than 30 minutes and memory loss after the injury or penetrating skull injuries longer than 24 hours. Survivors may have limited functions of arms or legs, abnormal speech or language, loss of thinking ability, and emotional problems. After getting a TBI, it is going to take a long time to recover. Some people never fully recover. A mild TBI may not require specific treatment other than rest. Sometimes, if a person has a mild TBI, there is no specific treatment. However, it is very important to follow instructions from a healthcare provider to completely rest and gradually return to your normal activities. If a person resumes normal activities and starts experiencing TBI-like symptoms, the healing and recovery process might take longer. Certain activities like working on a computer and concentrating hard can tire the brain even though they are not physically demanding. The person with the injury may need to reduce these kinds of activities to let the brain rest. As you can see, there are two different types of TBIs. One of them is more life-threatening than the other. If a person receives a severe TBI, in most cases, emergency care focuses on stabilizing the patient and promoting survival. This means that the emergency specialist will have to ensure appropriate oxygen flow to the brain, controlling blood pressure, preventing any further damage to the neck or head. After the patient is stable, there are other types of care for the TBI, such as surgery. There are three types of surgery that can be performed for the patient. The first type is a blood clot removal, meaning bleeding in the brain or between the brain skull can lead to large areas of clotted blood. Sometimes they're called hematomas that put pressure on the brain and damage brain tissue. The second type of surgery is to repair the skull fractures, meaning that the surgeon will either set severe skull fractures or removing pieces of the skull or other debris from the brain so that can help start the healing process for the brain. The third type of surgery is relieving pressure in the skull, meaning that the surgeon will make a hole in the skull and they will shut or drain that can relieve pressure inside the skull to allow excess fluid to drain. Medications may also be a treatment for your symptoms of a TBI to lower some risks that are associated with it. Here are a list of some medications that can be used. Anti-anxiety medication to lessen feelings of nervousness or fear. Anti-aglots to prevent blood clots. anticonvulsants to prevent seizures, antidepressants to treat symptoms of depression and mood instability, muscle relaxants to reduce the muscle spasms, stimulants to increase alertness and attention. Brain injuries are common and they can happen to anyone. So in conclusion, brain injuries can happen to anyone, so just be cautious and be careful.